So in the last video, I talked about how the inflammation get triggered in the body. What you do that will trigger the inflammation. In this video, I would like to talk about what you can do to cut down the inflammation. Why is it important for us? Because if you look at it, there are inflammation markers in the body, and some of them are like a C-reactive protein, interleukin 6, which you can measure the sedimentation rate. You can measure when you have elevated C-reactive protein or interleukin 6, it can kill you 50% more. Yes, 50% more. So inflammation is very, very bad thing for all of us. So we need to watch how to cut down the inflammation marker in our body. For the patient who come to me, I check C-reactive protein for them. I want to check that how is that behaving in the body. And when you have C-reactive protein elevated, you can get 60% more strokes, 60% more heart attacks. So you can see that it is a dangerous thing to have. So what you can do to cut down your inflammation marker? First, as I said, emotions, anger, frustration, irritability. We all get frustrated. We all get angry, isn't it? But what do you need to do? We have to look at the source of it. See, what is making me angry? Why I'm so irritable? So you go inside and look at you, why you're behaving the way you're behaving. What you can do to cut that frustration, that irritability and anger. Meditation, calm down. Make sure when you say anything, that word is not inflammatory. It's like when you say angry words to others, it's like a fireball. You have holding a fireball in your hand and you throw at somebody else and he throw three balls at you. So it becomes like a vicious cycle. We're going back and forth, back and forth with this vicious cycle and more inflammation, more inflammation. Smoking, again, as they call smoking gun. There's a reason why they call it smoking gun. When you smoke, you are creating so much free radicals in your body. Like the body has a hard time handling with it. So stop smoking or get help. I know it's but not very easy. So there are lots of, because there is addictive pattern to it. But you can try acupuncture. You can do the counseling. You can even try patches, which I'm not great fan of it. There are some medication which you can do though, but you can try starting from benign and then go to the more the like a medication type of stuff. Stop taking sugar. Sugar is the worst thing for us. What it does when you eat sugar, even in natural form, the most natural form of sugar is honey. I tell my patient, you can have 1 to 2 teaspoons of sugar a day, shouldn't be a problem. But excessive than that, every other sugar form which we have in the mother nature is not nature made, is made by us as humans. Take your white sugar, you squeeze the sugar cane, the dehydrated, make into sugar crystal. Agave, which is a natural form of sugar but still concentrated. Maple syrup, 100 liters of liquid is concentrated into 1 liter. So these are not very natural form of sugar. Any sugar you take it, coconut sugar, beet sugar, this sugar, that sugar, all is very highly concentrated form of sugar. So sugar should be avoided at all costs. And what does to you when you eat sugar? It triggers the insulin, and the more sugar you eat, the insulin converts your sugar into glycogen, and that glycogen gets stored in your liver, in your muscles if you exercise. Otherwise, it turns into fat. And after some time, that insulin becomes resistant. It's not able to convert that thing. And what it does, it makes more blood pressure to go up, make you more inflamed, more inflammation, make you gain weight. Also triggers wrong cells in the body and triggers cancers. So sugar is our worst enemy. You can grow cancer cell like wild when you feed that cancer a sugar molecule. It just goes out of your hand. So want to make sure that sugar is not your part of your diet. Food. Certain foods make more inflammation. So like one of them, the example which we call nightshade family. So potato, tomato, bell pepper, eggplant. Nothing wrong with that family. But certain folks out there will react to more. And you see when you eat those food, if you have inflammation triggers in you, you're going to get more inflamed. You get stiff hands, stiff joints after eating. So avoid that food if you are inflamed. But there are lots of other vegetables. Vegetables are amazingly good tool to cut down the inflammation. Add broccoli, cauliflower, kale, chard, okra, cucumber, carrots, beets. Amazing, amazing. These vegetables will cut down the inflammation. If you're not used to it, no. In our society right now, we are people are not used to eating vegetables. They're eating very less vegetables. So start slow. Maybe start with 1 cup of vegetable a day and stay there for 1 week. Then next week add another cup. Stay there for another week. Third week another cup. 3 cups now. And next week another cup. 4 cups. So slowly, slowly rev it up. Because once you start taking 4 to 5 cups a day, in the beginning, your tummy is gonna bloat because all those bacteria are not used to it. They have to change. They have to grow. It's like a yogurt culture. You put yogurt culture in the yogurt, the milk, you become the yogurt, but it is a process. So your gut has to adapt to it. Your bacteria has to adapt to it. So grow slowly with the vegetable. Add good oils. Our diet is very rich in omega-6 oils, like your canola oil, your sunflower oil, your soybean oil, your vegetable oil. These are very heavily loaded with omega-6 oils. You want to change it to more omega-3 oils. So what has more omega-3 oils? Like your fish oil, flaxseed oil, walnut oil, avocado oil has some omega-3 in it too. These are more omega rich oils. So you want to eat more omega-3 rich oil rather than omega-6 oils. And so you have a handful of walnuts. You got good flaxseed, chia seed, another one. Salmon fish is another omega-3 rich food. So we are eating too much omega-6 oils, which is not really good for us. Uh, Stop eating junk food. Don't eat any junk food. That will stop the whole process right there. Infections. So make sure that you don't have infection. Get tested. You can go to the doctor. They can test your stool. They can check your urine. They can check your teeth, and maybe check for the some more problems like your gut infections, or you're checking for the fungus or yeast in your gut, even checking for Lyme disease. And these chronic infections can make you sick. So once you find out what kind of infection you have, there are treatments available. You can help them with natural medicine, even sometimes with the synthetic allopathic medicine. So once you have these problems recognized, the solutions are there. Uh, don't do excessive exercise. Calm down. I said in my previous videos too, the exercise, what I believe is the three kind. One is like aerobic exercise. To me, aerobic exercise is like interval walking. You walk fast, you walk slow. 3 miles per hour, 4.5 miles per hour. You can do 1 minute, 1 minute each. So what this does, burns more calories, keep you more fresher and more active. Then you want to do weight training. Weight training is very important to push your sugar converted into glycogen to your muscles. So when you do weight training, your muscles get bigger, your circulation increases. And then the third one, which you need to do, is the stretching. I see a lot of bodybuilders out there, they're just like walking like this. They have a hard time. They are not very limber. They're very, very stiff. You might have seen when you go to a club, all those people who burn, pumping this several thousand pounds of weight, and they're very, very stiff. And they cannot even bend forward. And most of them, they pull their back out and neck out, or lower back out because of their so stiff. So you have to be limber. You have to be stretched out properly. So do the stretching, do yoga. And then last but not the least, do meditation. Calm down, relax. I've given some meditation video previously too. There are so many thousands of techniques of meditation. Do that. Calm your mind, calm your inner soul, connect to your inner soul, and you will see that there's a wonderful peace inside you, which is really very, very important. Get a good quality sleep. If you don't sleep at night, so most of the folks right now are going to bed around 12 o'clock, 1 o'clock. So what does it? Triggers your cortisol levels. When you trigger cortisol level, your night crew, like your melatonin, your serotonin, these hormones does not come at night, and which are anti-inflammatory, and you are never gonna get lesser inflammation. So go to bed by 10 o'clock, wake up by 6 o'clock. You should have around 7 to 8 hours of sleep. Everybody is different. Some people will be get by getting 6 hours of sleep. But I encourage everybody to get at least 7 to 8 hours of good quality sleep at night. You can sleep all day long, but your body will not heal. If you want to heal your body, you need to sleep at night from 10 to 6 a.m., 10 p.m. to 6 a.m. That's the best time. This is Dr. Virender Sodhi. Hi folks, Dr. Virender Sodhi. We're producing this wonderful videos, educational videos for all you guys. So if you please subscribe to it, press that bell icon and share with your family and friends. Thank you very much.